Hi, I'm Dr. Emily Kirby, board certified plastic surgeon in Fort Worth, and I wanted to answer a question that I get a lot. When we do abdominoplasty or a tummy tuck, which is one of my favorite procedures, it's a body contouring procedure, sometimes we can offer people something called a drainless abdominoplasty. So normally with an abdominoplasty, we're going to be placing 1 or 2 drains in. They stay for anywhere from about 10 to 14 days after the surgery, ideally not any longer than that. Some patients are going to be good candidates for a drainless abdominoplasty. So people ask, am I a candidate for drainless abdominoplasty? So first, number one, when we give you instructions after surgery and we give you guidelines, it's important to remember that I cannot speed up your healing process. What I can do is help you optimize your healing. There's so many things that we talk about during that healing process. We talk about eating the right nutrition and avoiding certain activities and wearing certain garments. And of those things that we talk about, it's very important to really toe the line and remember those restrictions after surgery. So if you tell me that you are a rule follower, then I know you're going to be following the guidelines that we've set forth, and I can trust that you're going to be avoiding certain activities. So number one for me is if you are a rule follower. So number two, if you have a lower BMI, your body doesn't make as much fluid after surgery. So number two, if you have a lower BMI, ideally under 30, but even lower is better, then we can offer a drainless abdominoplasty. Number three, we often perform liposuction at the same time as abdominoplasty. If I'm going to be doing a lot of liposuction in or around that surgical area, I'm not going to be able to offer a drainless abdominoplasty. When we do liposuction, we not only put in a lot of fluid, but we're taking out fat, and that creates a lot of fluid in the body. So there's too much fluid floating around for me to offer drainless abdominoplasty when we are doing a lot of liposuction at the same time. And finally, when they do studies, they look at the amount of weight that we remove in abdominoplasty and what your body does in response for that. And what we know is that when people have lost 60 pounds, 80 pounds, 100 pounds, 200 pounds, the amount of tissue that we're removing, the weight of that tissue, is directly related to how much fluid your body is going to make after surgery. So if I'm removing a very heavy amount of weight after a large amount of weight loss, I'm not going to be offering a drainless abdominoplasty because I know that your body is going to be making a lot more fluid than somebody with a lower amount of weight that I'm removing. So number one, rule follower. Number two, lower BMI. Number three, not too much liposuction. And number four, a lower weight of tissue that we expect to remove.